Hello and welcome to TechFunnel.com's interview series. My name is Danny White, and today we have the opportunity to talk to Dr. Jeffrey Pfeffer. Dr. Pfeffer is the Thomas D. II Professor of Organizational Behavior at the Graduate School of Business at Stanford University, where he has taught since 1979. He is the author or co-author of 15 books, including Leadership BS, Fixing Workplaces and Careers One Truth at a Time, Power, Why Some People Have It and Others Don't, and his latest book published last year, Dying for a Paycheck, How Modern Management Harms Employee Health and Company Performance and What We Can Do About It. He received his PhD from Stanford University and has been a visiting professor at the Harvard Business School, Singapore Management University, and London Business School, among others. He currently serves on the advisory boards for Collective Health and Corso and on the board of the nonprofit Quantum Leap Healthcare. He is in the Thinkers 50 Hall of Fame and has been listed as one of the most influential HR international thinkers by HR Magazine. Dr. Pfeffer, thank you so much for joining us today.
It's a pleasure to be with you.
Awesome. So can you briefly share your very storied journey from your days as an assistant professor at the very young age of 25 at the University of Illinois to now a distinguished professor at Stanford Business School?
Yep, well, the University of Illinois was my first job in the Twin Cities of Urbana-Champaign, and then I moved for 6 years at the University of California at Berkeley, and then I came to Stanford in 1979, where I've been pretty much ever since. And over my research career, I've written books really in probably 4 or 5 different areas. I've written 3 books on power because I teach an elective at Stanford called the Paths, P-A-T-H-S, to Power, which is one of the most popular electives, and it's actually diffused through course assistants and other people all over the world. We have about 150 people on the waiting list and 136 people in the class. So I've written 3 books on power. I've written several books on human resource management, including competitive advantage to people and the human equation, building profits by putting people first. I wrote a book with my good friend and colleague Bob Sutton called The Knowing-Doing Gap, which is why and how organizations ought to turn their knowledge into action. Bob and I also wrote a book on evidence-based management. And most recently, I've become extremely interested in the effect of workplaces on human health, and that resulted in Dying for a Paycheck.
Wow, very interesting. So you write a lot and talk a lot about organizational design and behavior, and this has really led you down a path of seeking to understand more of the public health crisis as it relates to people in the workplace. What made you want to focus on healthy work environments?
Well, for a number of years, I've sat on the Stanford Committee for Faculty and Staff Human Resources, and before that, I was on the Human Capital Advisory Council for Hewitt before they got bought by Aon. And if you have spent any time with HR people, you will see that they are completely obsessed with controlling healthcare costs because most large employers in the U.S. are, of course, self-insured. And in their efforts to control healthcare costs and try to, so to speak, bend the cost curve, they spend efforts on health and wellness programs, which certainly Stanford does. They've tried to do things to fix the offerings in the cafeterias. Many of them offer exercise classes, yoga classes, stress reduction classes, etc. But if you think about it, these activities fail to, which is one of the reasons why most of these evaluations of them show that they don't do much, really fail to address the root cause of the healthcare cost crisis, which is workplace stress and the unhealthy behaviors that stress causes. So it occurred to me that somebody ought to point out, number one, the enormous cost of workplace stress in both lives and dollars to human beings, and of course to the human beings who suffer from it, but also that we ought to get people focused on the things that are going to actually remediate workplace stress, which is preventing it in the first place. So, instead of putting in a nap pod, why don't you let people get enough sleep? Instead of having stress reduction workshops, why don't you try to prevent stress in the first place? So that's kind of why I wrote the book.
Awesome. Has this connection between stressful work environments and damaged health always been there, or has it been an evolvement or awakening to the fact that overwork is really, killing us in the long term?
Well, the relationship has certainly been there for a long time, and one of the striking things is that some of the epidemiological evidence on, for instance, work hours and health, or the absence of job control and its effects on ill health, go back literally decades. I think the awareness has continued to grow. I think the problem has gotten worse. Many of the things that cause stress have gotten worse over time. At least in the U.S., work hours are up. Economic insecurity, not knowing what your schedule is going to be, not knowing if you're going to have a job, as people now work in the gig economy, that has certainly gone up. With computer monitoring, the absence of job control has gone up. So many of the workplace stressors have certainly increased, but the basic relationship between workplace stress and ill health has existed for a long time.
Got it. What would you like for business owners and team managers, company CEOs to understand about workplace environments being a critical source of employees' health issues?
That what I would like them to understand is really something that is both simple but profound, and that is that in many organizations have created a lose-lose situation. So it's not just the case that long work hours, for instance, are harmful to employee health, and the evidence suggests that they are, or that the absence of job control is harmful to employee health, although it certainly is, but that many of these practices are in fact harmful to the companies and their own performance. The evidence suggests that beyond a certain point, work hours actually decreases productivity. We've known for probably 40 or 50 years that giving people job autonomy and not micromanaging them increases their engagement and motivation. We know that if we provide accommodations for people so they can more readily attend to their family responsibilities and don't face enormous amounts of work-family conflict, not only do employees benefit and have their health benefits and healthcare costs go down, but the organizations do as well. One of the shocking statistics is that most studies of workplace health and their consequences indicate that the indirect costs of ill health, not the direct costs on healthcare, but the indirect costs on things such as turnover, absenteeism, and presenteeism, being there but not really being productive, are somewhere between 5 and 10 times the direct costs.
Oh, wow.
So as I tell my friends at Stanford, if we're spending, which we are, $200 million a year on health, the real cost is probably $1 billion.
Wow. So that's a deep cost. So in your book, Dying for a Paycheck, which, by the way, is a really good read, on which the premise of this connection between the workplace and this public health crisis is built, you note that there are some challenges with this idea or concept of, if your job is not working for you, just go find another one. What are some of those challenges, especially from an individual psychological perspective?
Well, number one, in order to find another job, there has to be other jobs. But beyond that, as one person who I interviewed for the book said to me, finding a job is in fact a job in itself, which I suspect most of both you and your listeners could appreciate. So if you are really stressed out and exhausted at work, you may not have the physical or psychological resources to expend the effort to go find another job. And even if you do, you will probably, if you're really stressed and exhausted, not show up at the interview for that job in your best shape. So that is certainly one, I think, kind of big issue. In order to extricate yourself from the workplace, number one, you need to be able to have some job options. But number two, you need to have the kind of the resources and the mental resilience to go out and do that in that time, and that is often very tough to do.
Has offering options such as fitness, yoga classes, meditation sessions, nap rooms, the typical things that some employers have begun to offer their employees to counteract this problem in a way, has it helped to fix the problem, or is it more that the global cultural mindset of overwork and pulling all-nighters really needs to change?
It's the second, for sure. I mean, and as I said earlier in the interview, which is exactly right, I mean, most of what organizations have tried to do is palliative. So I'll give you a nap room, I'll give you a yoga, I'll worry about the food, I'll give you a program here or there. But the fundamental thing is that you have to really prevent to the extent possible, the workplace stress in the first place, rather than trying to, give people some ways of coping with it. Prevent, as we know from the total quality movement, as we know from medical practice in general, prevention is much more effective and certainly way more cost effective than trying to remediate the disease or the stress once you've incurred it.
Absolutely. What are some ideas you have for how employers can be held accountable, really, for being good stewards of the lives that they've been entrusted to? Certainly, it goes beyond just each individual employee and extends to like that employee's spouse or that employee's children or, employees' relatives. How can employers be held more accountable?
Well, as I point out in the book, a single item self-reported measure of health status is reliably and prospectively predicts health outcomes, including mortality. There is, as really a lot of emphasis now on measuring corporations, particularly the large corporations, environmental performance, kind of ESG stuff, the sustainability and environment and governance stuff, but many of these things measure things like do I recycle, which is of course important. What is my carbon footprint? Am I using energy efficiently, et cetera, which is all of course important. But oftentimes these reporting systems do not measure very much about the employee health and well-being. And there are numerous measures, as I said, a single item measure of self-reported health. The Gallup organization has their well-being index. Vitality, which is a company, which is a division of a large insurance company in South Africa, runs a survey for the healthiest workplaces in the UK, and they have a survey instrument. So it is, if employers are interested, and you used a very important phrase, in being good stewards of the psychological and physical lives that have been entrusted to them, the measures, I think, are quite abundantly available.
Awesome. So in an idealistic world, what would the perfect work environment look like?
Perfect. Well, in the ideal work environment, the perfect work environment we would not have to. I mean, it's not like some utopia. It's actually doing things that some organizations, like Patagonia or the conglomerate Berry Waymiller or Zillow, in fact, are already doing. Number one, certainly in the U.S., you would offer health insurance to your employees, and the health insurance would be offered in a way that employees would respond no to the question, have you had to forego filling a prescription or accessing a doctor because you couldn't afford it? So number one, you offer health insurance. Number two, you work people reasonable hours and don't expect them to be on 24/7. Number three, you offer various kinds of accommodations so that they can balance their elder care and child care and spousal care responsibilities in a reasonable way with what they need to do at work. You certainly don't micromanage them. You give them some autonomy and control over their work, and you treat them fairly. You create a workplace which would be characterized by, if you will, organizational justice. And if you do those things, not only will your employees be healthier, but your productivity will be a lot better.
Absolutely. Final question, coming from an employee perspective, what do you think employees can do to maybe talk to their employers and help them understand these health risks and in general promote a better work environment for themselves and for their colleagues?
Well, I think employees, need to try to help educate the employers. I think there's, this kind of conventional wisdom that, if you're working all the time, that you're actually more productive, which of course there's a ton of evidence that suggests that isn't true. So I think one of the things that employees can do is help educate their employers about the extensive evidence on what affects employee health, on and how these effects on employee health have ramifications for absenteeism and turnover and productivity that are harming the employers as well.
Dr. Pfeffer,
so I would say it's kind of an educational issue.
Educational, awesome. Dr. Pfeffer, it's been a privilege to talk to you today. We really do appreciate your time and all of your insights. I would encourage our audience to read Dying for a Paycheck. It's an awesome read and filled with very good research and thoughts. Is there anything else that you would like to leave our audience with?
Nope. I think I just would leave with one thought. As according to the Centers for Disease Control, 90% of the U.S. healthcare spend is on chronic disease. Chronic disease is causing healthcare spending to rise all over the world. Chronic disease comes not entirely, but in large measure from stress and the unhealthy behaviors that stress causes, such as overeating, drinking, smoking, drug use, etc. So if we are going to solve, let alone hold aside the employer engagement and productivity problems, but if we're going to solve the worldwide healthcare cost crisis, we have to do something to make workplaces healthier.
Absolutely. Totally agree with that. Thank you so much for your time. We appreciate you stopping by to talk to us about this very, very important issue.
Okay, and I appreciate the questions and being able to share my knowledge, such as it is, with your audience.
Awesome. Thank you guys for listening to this interview. For these and other interviews and topics, you can visit us at techfunnel.com. You can also connect with us across social on Facebook, LinkedIn, Twitter, and Instagram, and subscribe to our weekly newsletter so you can stay up to date on everything that's happening in the industry. Thank you.